Welcome, everyone. This is Plastic Surgery T&A. That's Talk and Advice. And I am your host, Earl Stephenson Jr., board certified plastic surgeon here in Atlanta, Georgia. And we're about truth and transformation. For those of you who are new, I hope that you find this information very helpful. And if you do, just do me a favor. Please like, subscribe, and share. For returning viewers, welcome back. I appreciate the support for the channel. So today's topic, we're going to talk about plastic surgery consultations. You're probably going, oh my gosh, this is boring. No, plastic surgery consultation is the cornerstone of the relationship. It's the foundation which everything else is built upon moving forward. So again, we're going to really talk about what happens behind the closed doors in a plastic surgery consultation. You know, let me share a couple of stories I think that'll be really helpful. I've had people go to different consultations, clients that end up being in my office and we work with them that have some really kind of weird experiences. They'll come and say, hey, I had X procedure done, but I never saw the surgeon until the day of surgery. I didn't see him or her at the consult. I didn't see them at the pre-op. Heck, I just walked in, the staff treated me pretty well. I talked to the nurse gave me to the financial person spent a lot of time with me getting me signed up for surgery, and I never did really see the doctor. I didn't have to pay for the consult. The surgeries were relatively, modestly priced, so I went with it. That's not what you should expect, not at all. Or you have a consultation where you just have a surgeon that really is not into what he or she is doing. They're not even into you. They're just going through the motions. They come in, you see them for 15 or 20 minutes, and they're out the door, and you see all those other people that we talked about. On the flip side, you have people or clients that come in that are, not really taking this seriously. I've had personally people come in and get completely undressed, walking around naked in the exam room with no regard to courtesy for our staff, courtesy for me, and really treating this almost like I don't know, sexual venture. So weird stuff like that can happen. I've had people come in who would not allow me to examine them. Why would you come for the consultation? Why would you be so shy and maybe other factors that I can't give you a good recommendation because you won't let me examine you? Or you just pull something to the side. I can't give you a good evaluation to see if you're a good candidate for whatever you want to have done. So, in this episode, we're really going to try to talk about some of the things that I think are important for a plastic surgery consultation. Why do I think it's the most important step? Because, like I said earlier, it is the foundation. It is a good meeting point where you, as the client or the patient, have done all your research, hopefully, and you get to come and see someone like me in real time. Am I engaged? Do I seem confident? Am I likable? I mean, I think that's important. You got to be able to like me, to trust me. Am I credible? Do I take my time? So you get to vet me, which is really what you're there for, to vet me and to get answers to your questions. And then, of course, pricing. But I'm also here to vet you. I think there's a misconception that when clients come in, of course, they're doing all the vetting, they're doing all the research and kind of scrutinizing, and they decide, oh, I want to work with this plastic surgeon or I don't. It really is reciprocal because you come in, I have the right to say, yes, I think you're a great candidate and I want to work with you. Or, I don't think this relationship is going to work out one way or the other. So it's really a mutual examination from client to doc and from doc to client. So that's why I think it's important. And so when you start out and set the foundation and set the boundaries, just like any relationship, you set the boundaries of what is acceptable behavior, expected outcomes, the environment, atmosphere, then you set the foundation for, I believe, success or failure. So that's why I think it's important. That's why I think a plastic surgery consultation shouldn't be 15 minutes, or you shouldn't spend 15 minutes with the doctor. I think a good, solid plastic surgery consultation should be at least 60 minutes. Let's break that down. So, what should you expect? Obviously, we're going to talk about the common things. You're going to get paperwork that goes over your health history. And yes, it's a lot. Sometimes we can't help it. We have to know certain things. And we'll dive into a little bit more of that moving forward. But you're going to get health history. You're going to get financial responsibility documentation because at the end of the day, somebody has to be financial responsible. You have to know, again, the parameters of which you're entering this relationship. So that's important. You're going to get paperwork on about um, requiring you, not requiring, but requesting of you permissions. Can we use your photos for marketing? Will you be willing to give testimonial? Are you okay with others being in the operating room or the office because we strive to you educate young physicians, or we have a mentor program. You have to understand again the parameters of the house that you're walking into, and you have to be comfortable with that. So you're going to probably get that paperwork. And of course, you're going to get paperwork for HIPAA so that we can, again, which ties into what I just said, make sure that we are compliant and keeping your medical information safe and secure. A lot of times we can do that online. We're in the age of technology, and you can fill that out online. Or, some docs are a little bit more traditional, and they will have paperwork that's paper. So you expect to come in and fill that paperwork out. It's really helpful, and I know you hear it, but it really is for you to come in a couple minutes early and fill that paperwork out, or somehow download the paperwork or have the office send you the paperwork and complete it before you get there so that you're moving forward on the consultation at the pace that is reasonable so that you don't get behind and kind of ruin your process and other things you have to do for the day, or for heaven's sakes, slow the whole process down in the office and somebody else is running late because we didn't stay on time. So it's important for to fill out the paperwork, and it's important to have that done if you can prior to getting there. So you're going to expect paperwork. You're going to expect to pay probably a consultation fee. And this is a big topic. There are free consultations. There are consultations that cost anywhere from $50 to $500, depending on where you are in the USA. And that depends on geography. That depends on the surgeon's experience. Uh, and honestly, it depends on if surgeons were honest, it depends on the practice bills and expenses or overhead. So it is not unreasonable to pay for a consultation. As my mama would say, you get what you pay for. If you get a free consultation, then you're probably not going to see the doc or not spend too much time with the doc. You're going to be rushed through. There are going to be a lot of people there because that model is we need to see more patients, more patients, more patients because this is free. We're not able to charge to cover bills and time for staff and physicians. So we got to see a bunch of people, and hopefully out of 100 people, we can, book 10 surgeries, which will then cover our expenses. And we got to keep playing that game. And that's a really rushed environment, in my opinion. I don't think you get the level of personal care, but some clients are okay with that. That's just not how we roll. So I think it's reasonable for you to expect a consultation fee, whether it's $500 or whether it's $50. And then you have to decide, is that amount of money giving me value? I want this certain doctor because he or she does X, Y, and Z, and I like their work. And you go and you pay, and you get that value hopefully by time spent and having an extraordinary experience. So expect a consultation fee. What you can do is expect to be brought back and have some intake questionnaires by the nurse or the medical assistant. And yes, it's going to go over the paperwork again, and it gets annoying. I get it. But these are checks and balances. The more we ask the same questions, the more we can minimize things falling through the cracks. So you're going to get repeat questions, and you just have to kind of understand that. I know everybody's been to the doctor and they understand that, but going to a plastic surgeon is no different than going to some, what if you're a medical doctor, if you have high blood pressure, excuse me, you're going to get repeat questions because we want to make sure that we're not missing anything. So please don't get annoyed by that. Y- During your consultation, you should expect that you will have to expose the area of concern and have pictures taken. Now, I know clients are really shy. We're not here to embarrass anybody, but you have to wrap your mind around that you will have to expose yourself to a degree. And you have to be comfortable with this. This is a professional environment. It's nothing salacious. So you have to be prepared to take pictures and talk honestly about your concerns and be ready for that step in the process. You should always meet with the plastic surgeon. I'm just sorry. There's no reason you're going to go and submit yourself to uh, a potential procedure that has potential downsides, and you never meet the person responsible for your well-being. That is just totally unacceptable. You just can't do that. You just can't have that. So you should always want to meet with the plastic surgeon, and that plastic surgeon should have time for you. They shouldn't double and triple book themselves where they come in. The nurse is kind of giving them the spiel. She wants a breast lift or a breast augmentation. You come in, hi, I'm Doctor Blah blah blah. You do some recheck the measurements. You do a 2-second exam, and I think you'll be perfect for this. And then you walk out. That's not a good value for any money or no money. That's just not a good value. You, as the client, don't get time to really vet the doc. You don't listen to his or her style, the way they speak, the way they move, the way they position themselves. All these things are important because you really can gauge and size up your feelings about that person. Use your intuition. Your intuition is more times not right. So you should always meet with the plastic surgeon. And then you should expect a quote about the procedure or procedures in that you want. And that should be itemized, in my opinion. You shouldn't just get a number. It should be itemized. And we're going to go over a quote that I've got from a real, client from way back when, and all the information has been protected. But we're going to break that down. So you should expect a quote. You should expect also at the time that you leave all your information either emailed or given to you so that you can go home and talk to the people that matter about this experience and how you want to move forward, or you've decided not to move forward. But you need to be able to share this information in a digestible form with the people that matter to help you make your decision. So that's what you should expect. That's what you should expect from a consultation. Some people will ask, well, is a surgical consultation different than a non surgical consultation? It can be. It just depends on the practice. In a non-surgical consultation, you may probably not going to see the doc. Let's just be honest. That's going to be delegated to uh, nurses, medical assistants, estheticians for a bulk of the consultation. The doc may walk in and say, "Hi, nice to meet you. Yes, I agree with the recommendations of Susie. We'll get you started. Do you have any questions?" And then they're out. I think that's reasonable, but in our practice or my practice, you see me. We sit down, we discuss, just like we would in a surgical consultation. It's no different. Your desires, your expectations, what I can actually produce, and we try to marry that so that you have a good understanding of what is possible, the pros and the cons, and whether you're willing to accept that. and then we move forward. So, yes, there can be a difference between non-surgical and surgical consultations. Surgical consultations are typically longer. You should see the doctor versus a non-surgical consultation, which can be shorter. And typically, you may not see the doctor other than just to validate what's already been decided. An important concept of the consultation on your end is communication, honestly and openly. If you need to bring your plus one, your significant other, then do so. Excuse me. And hopefully, you guys would have discussed this beforehand, but bring them, tell the staff and the plastic surgeon what your concerns are, why you're here, what do you expect to get out of this? When asked questions about medical problems or recreational history, this is not the time to be shy. This is a no judgment zone here. We just need the information so that we can decide if you're a candidate. And then, if you're a candidate, can we provide this safely and get you the results you want? That's it. That's all. We're not going to lecture you about recreational drug use. We may say, I don't think that's in your best interest, but if you want to have this done, we need to have X, Y, and Z done. Or you smoke. You're not a candidate for this particular procedure. If you want to become a candidate for this procedure, you may need to quit smoking. It's not a condemnation on you, the person. We don't go say you're bad because you do X, Y, and Z. We just need the information, just like we need the information about your medications for all the medical issues you have. You would be surprised that people come in and they, one, don't know all the medical problems they have. And two, if they do, they don't know all the medicines that they take and what the dosage is and how often they take it. So if you're someone who takes medicine for medical problems, write down all your medical problems. High blood pressure, I have diabetes, I have uh, high cholesterol, I've had a heart attack, whatever. And I take these medicines at this strength this many times a day. Just having that information in general for you would be huge because you never know when that information will be needed. You might get sick and no one knows your medication, but if they know you have it written down somewhere, then they can know what you take and hopefully get you better. Your spouse may not know all your medications, so plus one. So it's good for them to know that and to have that. When you go to your gynecologist, your primary care physician, your dermatologist, it's nice to have that. And again, going to see your plastic surgeon is no different. We dumb down cosmetic surgery, aesthetic surgery, but it's still surgery and it's still medicine. So having that information prepared so that we can have that, so that we can determine if the medical problems that you have are reasonable and stable to basically put you in a category like someone who is not ill or doesn't have those issues that we can operate. And two, if the medications that you have will interfere with any of the medications that we may prescribe, the anesthesiologist or anesthesia provider may provide, we want to make sure that there are no interactions and no problems. So that information is super, super important. So breaking down the key elements in a successful consultation. We talked about the medical history and health assessment. We just talked about that. And it's critical for patient safety. So again, bring those medications, be honest and open about what you have as far as medical history and problems, even if you think it's insignificant, and what you do recreationally. It's important. We want to also talk to you about your goals. I want to hear in your own words, what do you want to have done? Why you want to have it done? And it's really important because you need to have it done for you, not for him, not for her, not for the job, not for, maybe some previous trauma. No, We need to make sure that you're doing this for you and you're in a healthy state of mind, which leads me to this. Mental health matters. There is a entity, a psychiatric diagnosis. I'm not going to say I hate to use that word. It is what it is. This is a psychiatric diagnosis, and again, don't take that as a connotation that you're crazy. Everybody has challenges in life. Body dysmorphic disorder is a psychiatric diagnosis where people perseverate on insignificant contours or irregularities that cause them great harm, great trepidation, great worry, whatever the word you want to use. But it's something so subtle that sometimes plastic surgeons can't see. And so we need to make sure that you're in a great state of mental health from that standpoint. And just, I don't mean to, again, be lessen the importance, but if you suffer from depression, if you suffer from anxiety, if you suffer from um, bipolar disorder, OCD, we need to know these things. Doesn't mean you can't be treated, but we need to know the medications. We need to know how your behavioral management is going. We need to talk to your psychiatrist like we would talk to your internist or your cardiologist so that we understand how you are doing mentally, how you handle certain stresses or triggers that may be present in surgery that we may not be aware of. So it's important. So mental health is important. Body dysmorphic disorder is very specific to plastic surgery because it focuses on some mild imperfections, and the client is really burdened by these. And a lot of times we can't fix those. We can make it better, but still, the person may still feel that it's not perfect. And so we need to recognize that from our end that we can't the help that is necessary is not through surgery. It's through continued behavioral modification and management and or medications through your psychotherapist and or psychiatrist. So it's important there. Back to medical history again. I'm jumping back and forth, but medical history is important. And one of the things that the big questions we get asked, even on the phone before people come in, is BMI. So let's talk a little bit about BMI. So BMI, I can bring that up. Just a second. I thought I had all the slides up. So here we go. All right, BMI, body mass index. Many years ago, there was a big push. BMI, BMI, BMI. You shouldn't operate on people who have a BMI above 25. So, what is BMI? BMI is known as body mass index. It takes the patient's height and the patient's weight in kilograms, height in square meters, and it creates a formula that spits out a number or a range. And they have classifications on people's weight based on these numbers. So, as you can see here in this illustration, you've got normal weight, you got underweight, you've got overweight, then you have obesity categories. And the long and short of it, many, many years ago, is that people under 25 are the only candidates for cosmetic surgery. Now, in the real world, I don't see patients that are BMI of 25. I see BMIs of 30, 35, 34. I have patients come in with BMIs of 40 and above. There's been a pendulum swing where we have surgeons who are high BMI surgeons, where they will operate on people who are BMIs of 40. I'm of the opinion that plastic surgery clients or patients can't just be people under 25, nor should they, in my opinion, be over 40. And I don't use that principle in in my practice. If you have a BMI of 34 or less, then I, over the last 2 decades, have successfully performed many procedures on these clients safely. So you go, why do we care about BMI since nobody has a really good handle on it? So BMI really lends itself to what we call our metabolic dysfunction. There's higher inflammation. There's a lot of adiposity. There's or fat. There are stresses on the cardiovascular system that can lead to weakening of the heart, higher blood pressure, insulin resistance, diabetes type 2. This weight comes with consequences. And there was a study done in 2022, I do believe, in the Aesthetic Journal, volume 2042, issue 7, July of 2022, that talked about, what's the impact of obesity in plastic surgery outcomes. And here's the article you can reference it. If you can read it, that's perfectly fine. But to summarize, people who were in the obese category had higher complication rates in regards to wound healing, fluid formation as part of surgical complications. And then they had higher medical complications in the forms of blood clots, DVTs, and potentially fatal problems such as pulmonary embolus, where a piece of a blood clot in the leg breaks off and goes to the lung. So again, people who are low BMI, 25 or less, probably a small segment of the population because the population in the US is more obese. They're probably less likely to be candidates for aesthetic surgery. People who are BMI of 40, and I'm not body shaming you, I'm not body shaming anyone, are having surgery, but they have higher complications. And so your surgeon, if he or she is a high BMI surgeon, then they should be prepared for all these things and more. And you have to be prepared as the client or the patient that you're going to have more complications. There's just data that shows that. So really, again, think about that as you go in. Again, in my practice, for the last 2 decades, I've operated on men and women who had BMIs of about 34 or less and successfully. Doesn't mean I didn't have any complications, but I had, I took good care of those patients and took care of those complications. When I start getting to BMIs of 40 and above, I or 34 and above, and certainly 40, I'm not. That's not where I feel comfortable because again, these patients have a higher risk of having cardiac problems because of stress on the vascular system in the heart. They have higher incidence of all the things that we talked about as far as medical complications and surgical complications. Heck, they have just higher problems or more difficulty having anesthesia. The anesthesiologist can't really see their airway well, and they have to control their airway. And that's really difficult when someone's heavy, has heavy tissues of the throat and neck. They can have heavy problems with them ventilating them, mechanically breathing for them because there's a lot of weight on the chest. There's chances of having difficulties in doing certain procedures because you can't put people face down if they're heavy. So it really ratchets up the risk. And I'm not a risky surgeon, certainly not with anyone's life. So I tend to stick in a sweet spot for me, which is about 30 BMI of 34 and below. So you got to know your BMI. So how do you know if have a good BMI or not? Here's a simple link that will help you with that. It's from the National Institutes of Health. And here's the link. You just go in and you just punch in the numbers. You can do your weight in kilograms, but if you're not familiar with the metric system or don't really use it that often, then you can put it in pounds. They have little conversions, and you can put you can put the weight in pounds, and you can put the height in inches instead of centimeters. So You can do this and it'll spit out a BMI and it'll tell you where you are. And you may decide that, if you're a BMI of, near 40 and you want to see a high BMI surgeon because you want to contour your tummy, then realize that body contouring surgery plus your high BMI can lead to more complications. Doesn't mean you can't have the procedure, but it leads to more complications. Again, we try to counsel people when they do have a BMI that's high that we need to get that down so that they are a better candidate. We can provide the service that they want, the results they want safely, and we have strategies for this. I work with a vetted group of weight loss management physicians and programs, so we just don't leave you high and dry. We just don't hand you a number, say you got to lose 25 pounds and go away and never check on you again. We give you solutions, or we try to give you solutions to your barriers to have from having plastic surgery. Again, that's what you should expect. So remember that link, copy it, and if that's of concern of yours, check it out before you go. So, what do you need to do to prepare for your consultation? There are a couple of things you're going to do, and I hope you do. But again, you never know. I've seen patients who've gone to cosmetic surgeons, and these surgeons are not plastic surgeons. They're gynecologists, they're oral surgeons, they're general surgeons, and they have a complication and they end up with a problem and they didn't know. Well, I didn't know he wasn't a plastic surgeon. I've had nurses tell me this. I mean, you would think people in healthcare would know. So that they just don't know. So you have to do your homework. So the easiest thing to do would be a couple of things. Here's a link. You just go to the American Board of Plastic Surgery. If your surgeon is board eligible or board certified, his or her name will be here. Doesn't mean that they don't have any complications. That means that they've gone through the process of plastic surgery training, plastic and reconstructive surgery training, which of that training, they have a component of cosmetic of aesthetic and aesthetic surgery. And they have performed these procedures time in and time again under direct guidance. They've practiced for several years before taking this examination uh, in their own practices. They bring their data, their cases, to a body of thought leaders in plastic surgery and they defend them. It's like a thesis, they defend them. And through that defense, through written exams and then these defense of your cases, this board determines if you're safe, not perfect, but safe. Do you make good judgments? So this is vitally important. You've got to understand that your plastic surgeon needs to be board certified or at least board eligible. And what that means, they just haven't gotten to the time spots or time marks where they can stand or sit for these particular examinations. But they will and they should navigate those to the end where they're board certified. So that's super, super important. A secondary way you can kind of vet your plastic surgeon beforehand so that you know that you really are a plastic surgeon and not get the okey doke is you can go to the Aesthetic Society. You can look up the person there. If they're there, then there's a couple of things that had to happen. It just had to happen. They have to have been in practice at least, I believe, 3 or to 5 years. That's just got to happen. That's a requirement. And they must be board certified. You can't join this society unless you've been in practice for at least 3 to 5 years and you're board certified. So that's another feather that you can put in the cap that your doc's certified by the American Board of Plastic Surgery and that he or she is a member of the Aesthetic Society. If they're primarily doing aesthetic or cosmetic surgery, in my mind, this is just my opinion, there's no reason why they wouldn't be a part of this society. It would be a little odd if they say they do exclusively cosmetic surgery or aesthetic surgery and they're not a member. Just kind of weird. Doesn't line up. So those two things are super, super, super important. So research the surgeon. You can bring a list of questions. That's perfectly fine. I don't say you can't or shouldn't. Write down your questions so you can organize your thoughts so that when you are talking with the doc, you make sure that you hit all your points that are important to you. So take the time, write down your questions. I've had clients sit with me and ask me questions for 45 minutes. And I'm good with that because at the end of the day, what I want is a well-educated client so that they can make, and I often say this, probably 9 times out of 10 at the end of near the end of the consultation. What I'm here to do is give you information. And what you're going to do is you're going to take that information, you're going to think it over, you're going to talk to your significant other and other people in your circle, and you're going to decide what's best for you. That decision may be you work with me. Great. That decision may be you don't work with me. Fine. That decision may be you don't have surgery at all. Okay. My goal is to provide you with information, truthful, honest information, so that you can make the best decision for you. That's it. I'm not here to sell you anything. I'm here to tell you what I can do with my skills and God given talents and give you truthful information so that you can make the best decision for you. So bring your questions. Your surgeons to sit down and not feel, not make you feel rushed or that you're just somebody coming through like a I was going to say an airline, but like a certain airline, just cattle call. No, that's not how it should be, in my opinion. Moving forward, if you want to bring before and after kind of reference pictures, people often call them pictures, then that's fine. Just make sure, just make sure from your end that the before picture, if you have that, if you go to before and afters, is somewhat similar to what you look like. So that you kind of have the same general building material so the doc can work with to get you close to what you want, the after picture. If you have a wish picture where you cut it out of a magazine, I want to look like that, that's fine too. Just remember that we're not trying to we can't match that. What we can do is tell you we can get close to that, and then here's how, or we can't get close to that, and here's why, which is more important. So bring those pictures. You should also come with, this is important, a good and realistic mindset. This is plastic surgery, aesthetic, cosmetic plastic surgery. We make things better. We don't make things perfect. You can have a tummy tuck. You have a little, you know, Dunlap over your belt. You got a little muffin top. You're a little fluffy. You've had your family. They're solid. You're ready to kind of wear nicer clothes, feel better about yourself, more confident. You have a tummy tuck. Everything goes well, and your scar's a little dark, but it's hidden well in your undergarments. You gotta, that's better, not perfect. You have a little bit of firmer area on one side than the other. That's not visible, but it just feels different. That's better, not perfect. So we don't chase perfection. We improve your natural contours so that you feel more confident. That's what we do. So come with realistic expectations and come with the expectation that you may not be a candidate for surgery. And I believe a good plastic surgeon or a good plastic surgery office will tell you why. I often tell patients, and patients have gotten a little upset with me, not mad, not belligerent, but disappointed. And I would tell them, I'd rather for you to be disappointed at me than the alternative. And I'm a little dramatic. You're not here. You had a fatal complication, and your family's irate with me. I'd rather for you to be walk away disappointed than to never walk away with any feeling at all. That's how I operate. So again, come with realistic expectations. one thing I missed. I think there's an important question in your list of questions. I think this is super important. I don't know how I forgot this. And I actually made a little slide about this. There's one question I believe that you should ask your surgeon. If you go in for a mommy makeover and they give you, we're going to do a breast reduction, no implants. We're going to liposuction the little bra areas. We're going to liposuction your tummy, and we're going to do a tummy tuck. And we'll add a little fat to your hips just to augment it so you have that nice shape. This is what we're going to do, and you're excited. You're really excited. You asked all your questions, but this is the most important question to ask. I'm going to bring that up now. What is the plan? I'm with you, Doc. I love what you're saying. I love your work. But what's the plan if I have a blank complication? Put in the blank. I have a wound of my nipple. I have loss of my nipple if I'm having a breast reduction. What if I get wrinkling or contour problems from my liposuction? What if I lose my belly button? What if I have a hematoma, which is a collection of blood underneath my tummy tuck incision? What's the plan? What do we do? How do you get me from that spot of fear, terror, to a point of safety and confidence? Your surgeon should have plans. Your surgeon, if they're honest, should have experience, just not plans. Yeah, I've had to deal with that because I've done so many fill in the blank mommy makeovers, tummy tucks. Yes, there have been a few patients that have had this. This is how we manage this. And we've gotten them to a point of safety, healing, and confidence. And they should be able to spit that out like that. Should be no stumbling. That is the most important question you can ask. Again, I try when people ask me that, I definitely have an answer for them, but I definitely go over the risks and complications. What are the downsides? We always talk about the pro side, but what are the downsides and how we combat those? Second thing that I do to give them confidence, I tell them as part of this procedure, part of your journey, we want protection. Just like you get car insurance, just like you get homeowners insurance, just like you get renter's insurance, excuse me, or life insurance. We have a cosmetic surgery insurance through Cosmetic that covers a lot of these things. You have an infection after surgery. We need to go back and clean things out. You have a hematoma or blood collected underneath the incision of a certain operation. They take care of that. You have, you know, irretractable pain or nausea and vomiting that requires you to stay overnight in the hospital when we plan for you to go home. We make sure that we have a policy in place for you to cover and to reduce your anxiety and concerns about that, plus our plan, to make you healthy and whole so that you don't have to worry too much about this. We offer this to we offer this to our clients, but everybody gets it. And it's part of your quote. So make sure you ask your surgeon how do they handle complications no matter what. So that's the most important question. You can ask them how many surgeries they've done of this. They may tell you the truth. To be honest with you, they may not tell you the truth. But you want to be very confident that they speak confidently about how to handle stuff when it's hitting the fan. Doesn't happen that often, but it can happen. This is surgery. So at the end of your consultation, this should be a solid, we're solid 50 minutes in, maybe even 60. You wrap it up with questions from the patient or the client, and you present them with a quote either then with your cosmetic surgery coordinator in our office. We prepare the quote and email it out to you. We let you digest that. And people are like, well, you hear these forms. I'll put it this way: you hear these forms, or you're in. I'm in some forms, and you go, "Wow, that is so expensive." Why is a tummy tuck that's extended with liposuction 360 $18,000? Why is it? We can go to Miami and get it for $10,000. Different states, different practice models, all the above. I believe with a typical plastic surgery model, You have a surgeon or a group of surgeons practicing in a major metropolitan area. The prices are going to be fairly consistent for, I hate to use it, but I'm just going to say it, for good quality experience, total experience, good consultation, good follow up, good communication, great surgery, great aftercare, all of the above. It's going to cost. So let's bring up a quote. I want to break down a quote. Why is it so expensive? Why can't I go? I can go to Miami, or I can go to these big box cosmetic surgery places that are all over the United States. You can have it done awake in this particular place. Fine, you can go there. Again, back to the beginning, as my mama would say, you get what you pay for. So you have a cosmetic surgery quote, and hopefully we cleared out everything. You can see in this quote, you can clearly see my fee for this breast procedure. You can clearly see how much it's going to cost for the anesthesia time. We got to pay the anesthesiologist. Their time is valuable. They have expertise that I don't have. You want to be comfortable? This is comfortable. This is what it costs in Metro Atlanta, give or take. We got to use an accredited facility that has all the quality control, the staff that's expertly trained, in plastic surgery. Not, and again, I'm not knocking hospitals. This can be done in a hospital where they're doing gallbladders and total hips and tonsils. You know, you, you got to pay for that, but you got to pay for, if you go into a cosmetic surgery only facility, you're getting an expertise that is really unique, and it is the only focus. So you got to pay for that time. Garments typically are paid for, and there's a fee for that. The cosmetic surgery insurance, there's a fee for that. So we talked about that a little bit. Any blood work, there's a fee for that, minimal, but a fee. And you add all those up. Now, in my in my practice, I don't charge for follow up visits. Certainly, there's some practices that do, and that's okay. That's whatever they want to do. But we don't charge for follow up. That's included in your price. So we get you from no confidence and a shape that you don't like, or contour that you don't like, to a confident, well contoured client, happy. So all your follow-ups are included. We don't get to 10 follow-ups and then start charging you. It's included. So that's why. Now you're going to look at my fee. Well, why is your fee so high for this particular procedure? I can go to Dr. X, who's board eligible or even newly board certified, uh, in your city, and get it cheaper. Again, I don't know his or her model, but let's just say the geography is the same. They're in Atlanta. They're board certified like me. They are reasonable and got good outcomes. You can certainly do that. But they only been in practice. They have been in practice for 5 years. I won't say only. They've been in practice for 7 years. I've been in practice for 20 years. So I've got efficiencies and techniques and ways to get patients safely through this process that you're paying for. Just like when you go and pay for a plumber, or you get an attorney, you try to get the best person you can with the most experience, who knows how to navigate the winds of this process seamlessly. That's what you pay for. Doesn't mean the kid that's got 7 years of experience is bad. He just doesn't have as much experience, so he can't command, or she can't command, as much of a fee. That's the difference. Now that is going to be determined by you. Are you going to go with experience? You're going to go with good reviews. You're going to go with a good overall experience, or you're going to go with somebody who's got lesser experience with all those other things intact. Good reviews, not as many. Good, overall experience, but just not the overall medical experience and outcomes and number of cases and number of satisfied clients. That's really a you decision. But whether this plastic surgeon has been in practice for 7 years or 20 years. In my opinion, my price here is, I think, about 16,000 total. His or her price may be 13 because it doesn't change the fee for the surgery center. It doesn't change the fee for the anesthesiologist. It doesn't change the fee for the cosmetic insurance. It just changes based on the experience. And that's, again, you have to determine what works for you. That's all. So expect a quote. You can expect follow up on that quote. This part of I still call this part of the process of the consultation. Within a couple of days, somebody's going to call you and ask you if you've got the quote, if you got any questions. I'm going off on a little bit of a tangent here. It's courteous on your end. Even if you think it's too high or you're not going to do it, just say, yes, I got the quote. So thank you so much. I don't think I'm in a position to move forward at this point. Or I've seen another surgeon and it's okay. And I think I'm going to go that direction. That's open communication. That's honest communication. That way we don't bug you anymore. But when you don't respond or we have to play phone tag and you're really not ready to pursue, then it doesn't serve you and it doesn't serve us. We want to make sure that you have a good experience because the last thing we want to do is to not have that link in communication and closure of the consultation process because we haven't had that final conversation and you just some clients will say, well, I didn't really like the experience because they kept bugging me. Well, we didn't really get a final say on what you want to do, and we will respect that one way or the other. Lastly, I had one more thing and I can't think of it. I just escaped my mind. We talked about closing the consultation, talked about fees. Fees are high. I talked a little bit about financing. You should get some information at the end of your consult or sometime thereafter with the quote about financing options. There are three big ones. Well, I won't say three. There are many. You can talk about Care Credit if the office offers that. You can talk about Patient Fi. You can talk about Cherry. You can talk about Alpheon. Heck, there may be even some practices that have relationships with community banks that can get you really good financing deals. But these are dialogues that should be had and openly had with the office. And so that if you're really serious and you want to be thoughtful and plan and not be financially irresponsible or put yourself in a bad situation, then work these processes out so that you can get what you want with the plastic surgeon you want safely and you don't break the bank or you don't wreck the budget. So these things can be done in a budget friendly manner depending on your budget timeline. So with that being said, I just wanted to take you behind the doors of a consultation. These are my takes. They're not the Bible or law and gospel, as my mom would say, but just my take. So hopefully you've got a little something from this. If you like, you know, our office, my work, or you want to have a deeper conversation with me about something that you're concerned about and you want to have a consultation, it's really, really simple. Pick up the phone and give us a call. Our number is 770-466-4700 here on the screen. We'll be happy to schedule your hour long or more. Sometimes they go an hour and 15, depending. We're not rushed. Consultation. Our consultation fee is $225. That fee comes off of your surgery quote if you decide to move forward. So that's a bonus. As I said, it's not a rushed consultation. It's a very, we like to say, engaging, relaxing consultation so that you can get the information, as I said before, to make the best decision for you. If you're still kind of figuring us out and you're not really ready to make that call, and you just want to some questions, you can send questions to this email right here, concierge@ESJ Aesthetics. And we'll be happy to answer any questions about any procedure and provide you with any information that will help you along the process. If you're still not really sure and you just want to check us out a little bit more, the best place to go, go to our website, www.esjaesthetics.com. Everything you want to see is there. Before and after pictures, services, of course, information about me, information about the team, pricing, finances, blogs, whatever. You can do a little bit more research on me before you make that call. So, really simple ways to kind of continue to vet me. But the easiest way, if you've kind of gone through that process, once again, is just to give us a call. So, on that note, I really appreciate your time. It's been a pleasure. I always enjoy doing these. Hopefully, you find these podcasts interesting, insightful. So, if you do, please support our channel and our channel growth. Please don't forget to like and subscribe to our YouTube channel in general. And then, specifically, if you want to subscribe to our podcast, we would greatly appreciate it. So, with that being said, I'd like to thank you for the time. Wherever you are in the world, please be safe. These are unusual and difficult times. Humanity cannot suffer. We must be kind to one another. On that note, enjoy the rest of your day wherever you are in the world. We'll see you next week. Thank you. Peace.